She's 31. She's an emergency nurse. She just came in wanting to maximize her health. She had no symptoms that were a key problem for her.
Okay. So she didn't want to tell you.
I guess. I mean, obviously she knew there was something coming up. She wanted to come in. She wanted to improve the way that she felt. She was experiencing a lot of fatigue.
A lot of what?
Interestingly enough, this woman fainted during the thermography session.
And then what did you do then?
Well, we stopped. We didn't continue.
Oh, so you did it another day?
I did.
So the reason why some people get to faint, and it happens maybe once a year, is people's old trauma from doctors pointed objects at them, I believe, triggers the trauma. I think it's there's a bit of a history of things like that with abusive relationships with doctors, and I think that some people, it has nothing to do with anything else, I believe, unless they're they faint from lots of things, but they don't usually.
She's never fainted before.
Yeah, it's very interesting.
It is. But you know what's even more interesting is the second time that she came in to do the thermography, we were pretty much finished the first session, and she started to say, "Oh, I'm feeling a little lightheaded." So I immediately had her lie down, and we took some extra time to allow her body to stay in the cool ambient room after she got back up again.
Had you done the second measurement?
No.
So in other words, you had her lie down, and then she got up, and then you took the second measurement?
But we waited 7 minutes.
But if you had her lie down, then you changed a lot of the dynamics and the back points, and her body's touching herself and her arms, and then you're changing a lot of things that will make this less and less accurate. So I wouldn't rely on this thermogram.
Okay.
But I would be curious to know what's happening. Now, an interesting thing is, though, when you see consistent results, like look at this head region, and all of the same points are way below the baseline. So even if the second test, the second measurement was inaccurate because you had her lie down and change positions and had all these influences, it still repeats the pattern that's there from the first. So it's actually reproducible of the behavior of the point. So it's very interesting that in some of these cases, you got very little change, even though the person had changed that much. So I think there is a lot of validity to this thermogram. And I think there is something going on with her nervous system because of these extremely cold brain points. And then the paradox. So I think there's something neurological going on, and then you see it also in the teeth. Something's really different. If you look at the two temperature difference between this point in the upper right and this point, this is crazy. And these are the first measurements, and she was not resting or anything. So then when you look at the dental, you see all these speckled teeth being so different. So I would really question what's going on with her neurologically, because she had this fainting, because the points are showing consistency. See, if this was a messed up thermogram that was useless, you wouldn't see this consistency of the second points would be way up high, or they'd be completely off. But they're not. They're staying fairly consistent with giving you a result that's within a certain variable temperature. So, she might have come in for this because she's scared that there's something very wrong going on. And I think I would ask her if she's having any neurological complaints, if she's had head trauma, if she is on any psychiatric drugs, or she could be on high blood pressure medicine, which would put her blood pressure very low, and then not have eaten, and then having an added re-traumatization or re-stimulation of a past trauma all coupled on top of each other. But it's a very hard thermogram for me to sit and say, yeah, let's look at this, let's try to determine some truth in this, except that when you don't know, the most important thing about this thermogram, and it's a very important teaching tool, is that when you get consistent results after all of that has happened, with a lot of these points in the neck and all along the lower part of the body, they're regulating, but hyper-regulating, but in the same way. You don't see, oh, this is where her arm was touching her abdomen, and so it's a blocked point here, and blocked points are scattered around. You see the cubital fossa here on the right is blocked, but everything else seems like it's not dependent upon her even lying down between. So there's some truth to it. And so, but I would be extremely concerned about what the real reason is why she came in. She must be worried about something, and she's either on some neurological drug. You see the RN point here. The second reading is coming down way low. This could be that she's on antihypertensive medicine that's causing her blood pressure to be low. But it's a very, very difficult to say with any certainty, yeah, there's importance in this, and let's, do an X-ray of the teeth or something to look there. I would want to know more about her, and I would be concerned that she's really coming in for some neuropsychiatric concern. These cold brain points are not okay. And the teeth being so different, one to the next, is also not okay.
Right. I'm just looking through her file, and the key issues for her were joint pain. She's had joint pain since she was quite young. Digestion, she wanted some focus on her digestive health. Yeah.
Well, I think first of all, I had another case in Texas where the doctor sent it to me, and the first glabella measurement was like 5 degrees different than the second glabella measurement. And so, this was a bizarre thing. So I sent it over to Germany to the goddess of regulation thermography, because I told him, you really need to just do the test again. This is not legitimate, but I'm going to check. And she said the same thing, where this first point here on this thermogram is 33.7 or 33.8, and here this one is 32. But on the thermogram I was looking at, the second one was down to like 29, so you didn't have anything close to the same temperatures. This can be within a couple of degrees of these first two glabella measurements. It's really how the glabella behaves that determines if the thermogram is legitimate. This started out to be legitimate because this first one goes down a little bit, 0.6, and this one stays the same. That's fine. That's a legitimate thermogram. But because of what happened during it, you can't rely on it. Mm-hmm. But I think you should ask her if she has any concerns about her nervous system, and then I would try to do another thermogram.
Okay.
But I might not want to, but I wouldn't get into what's causing her digestive problems because, yeah, you see this dysbiosis and maybe a little food intolerance in the small intestine, so, it can't hurt to give probiotics, but and I would do that, but I would want to retest, and I think with the next thermogram she should be over the shock of whatever is re-stimulating her. And you could also get a room spray with somebody like that, like a rescue remedy room spray, which would not block the nervous system from an adequate thermogram in such a case, so that it would make it, wrong. I think that's not a bad idea. Have you ever looked into
about just doing it all over again and being in the same place where we're at the end of the first reading and she starts to feel dizzy again?
Well, make sure she's eaten her breakfast in the
We
morning.
did the second time. Yeah. But and then after, because she came down so fast in the first visit that the minute she was told me she was feeling lightheaded, I had to get her sitting.
Yeah. Well, you can have a patient like leaning against a treatment table where their head's a little bit lower, just as long as the ovary points aren't in contact with their own skin.
Right.
And that way you'll get her, her head blood pressure won't be quite as compensated. And make sure she's had maybe some almonds or something. You could even give it to her, 15 or 20 minutes before the thermogram.
Okay. Do you know, there's something about this patient that I think that you might have hit on something in terms of past abuse, or there, being something going on neurologically.
Yeah. Well, because of these cold brain points coupled with her having this reaction.
Yeah.
And, people won't exactly tell you unless you're really good at it, and, they won't volunteer that kind of information until they get to know you better. So I would build your relationship with her and try to see what's there.